الميكروفون واللابتوب شغالة. الباوربوينت واضحة يمكم presentation you are shared with me my PowerPoint.
نعم دكتور واضحة.
Okay. I will discuss with you today the male reproductive system or male genital system. Histologically, the testis is made of Sertoli cells that are supportive cells and seminiferous tubules containing germ cells. These are the germ cells. Histologically, هيفد review سريعة. الgerm cells تبين هيك شكلها large cells because they are immature. When they go to the lumen, they becomes more mature till the formation of mature spermatid and spermatozoa. The interstitium containing the interstitial cells, Leydig cells, and matrix. The structures, the penis, urethra, prostate, and the testis, epididymis, and the Testis. Regarding the penis, Shabab, what is the lining epithelium of the penis? Lining epithelium. Shabab, what is the lining epithelium? The lining epithelium of the penis is skin. Stratified squamous epithelium. It can be affected by condyloma acuminata or acuminatum, which is caused by human papillomavirus, also called venereal wart or by benign lesion or benign pathology like condyloma acuminatum, which is a venereal disease or sexually transmitted disease called condyloma acuminatum, caused by human papillomavirus, also called venereal or genital wart. Whereas the malignant lesion, the malignant counterpart or the malignant pathology is squamous cell carcinoma, regular polypoidal lesion in the genital, also called genital wart or venereal wart. That is the condyloma acuminatum or squamous cell papilloma. Coilocytosis is the formation of perinuclear halo with racine or wrinkled nuclei. This is the effect or cytological effect of human papilloma virus. This is by cytology and this is by histopathology. Shabab, you can identify these changes: large perinuclear halo or perinuclear vacuole with dark colored wrinkled nuclei. This is the effect of human papillomavirus, especially type 6 and type 11. نفس الشباب اللي قلنا بالأورال cavity, which is one of the قسمناها إلى high risk و low risk. Type 6, 11 is low risk viruses, and 16, 18, 33, these are high risk viruses, high risk human papilloma viruses. هاي نسميها changes نسميها human papilloma virus HPV cytopathic effects, coilocytosis or coilocytotic atypia. The in situ changes or carcinoma in situ of the skin in general called Bowen's disease. Bowen's disease, when تسمعون Bowen's disease, it indicates severe squamous dysplasia or squamous carcinoma in situ. Whereas the invasive squamous cell carcinoma نفسها اللي هي conventional type بالoral cavity, بالsquamous in the skin, and anus نفس الشيء، نفس morphology، نفس squamous sheets infiltrating deep structures. من تصير invasive نسميها infiltrating or invasive squamous cell carcinoma according to the differentiation: mild, moderate, and poorly differentiated squamous cell carcinoma. Okay, والchanges اللي هي pre-neoplastic or pre-malignant changes including dysplasia نفسها اللي شفناها other involving the upper, the lower 1/3, 2/3, and full-blown thickness. If it is involving the full-blown thickness or involving the whole layer, it is called in situ, equivalent to severe dysplasia or Bowen's disease. نفس الشيء، نفس lesion هو carcinoma in situ, Bowen's disease or severe dysplasia. This is the Bowen's disease, morphologically, gross and microscopical appearance. You can identify here تشبه اللوكوبليكيا or المهم هي pre-malignant Bowen's disease، معناها carcinoma in situ without invasion of the basement membrane. Microscopically, you can identify here hyperkeratosis and the atypia involving the whole thickness of the squamous epithelium from the lowermost third to the surface epithelium. All are involved by atypical changes or dysplastic changes. Still, the basement membrane here is intact and no invasion, so it is called carcinoma in situ, equivalent to Bowen's disease. It is a skin lesion, the skin of the penis, involvement of the whole thickness by atypical changes or dysplastic changes affecting the uppermost, reaching the uppermost layer. شوفوا هنا المaturation، ماكو maturation بالuppermost layer, no maturation, so full-blown thickness dysplastic changes. Hyperkeratosis وهذه reactive changes and parakeratosis. Infiltration, invasion of the subepithelial tissue by malignant sheets of cells called infiltrating squamous cell carcinoma or invasive squamous cell carcinoma with features of squamous differentiation, including keratin formation and intercellular bridges. Disorders of the testis, شباب, disorders of the testis. We start with congenital anomalies. دائما congenital anomalies comes in clusters, sometimes more than one congenital anomaly in the same patient. The most common one, which is one of the commonest the congenital anomaly is cryptorchidism. Cryptorchidism or undescended testicle or abdominal testis. Failure of the testis, usually it is unilateral, it is bilateral in 1/4 of the cases. Cryptorchidism. تسمع عن cryptorchidism معناها undescended testis or undescended testicle, or called abdominal testicle. Failure of descent through the inguinal canal into its position in the scrotal sac. Usually it is associated with another congenital anomalies مثل الhypospadias or epispadias and inguinal hernias. The most infant cryptor have spontaneous descent, sometimes spontaneous descent in most of them, this or spontaneous descent into their pathway into the scrotum during first year of life, and surgical intervention can occur after that. Sometimes or many times the spontaneous descent can occur during the first year of life. ايش تتوقعون شباب هذه الcongenital anomaly cryptorchidism ايش تتوقعون ويا مع prematurity or low birth weight baby؟ تكون أكثر لو أقل لو ما لها علاقة؟ low birth weight baby or immature baby or premature birth. ايش تتوقعون؟ هذا الكريبتوراكيدزم can occurs more with immature baby or premature labor. شو تتوقعون؟ ماكو جواب؟ شباب وياي لو لا؟ تسمعون لو لا؟
نعم دكتورة أنت سمعت.
What do you expect about cryptorchidism? Is it more common or more occurs more with child or with immature childbirth or child with low birth weight? ايش تتوقعون؟ Logically, it is more common or more common in immature baby or low birth weight baby. So it is incomplete, partial or incomplete descent of the testis from the abdomen into the scrotum. So the testis still within the abdominal cavity and not descent into the scrotum. 1% of population, يعني عالية percent incidence. Bilateral in 10% of the cases, sometimes up to 1/4 of the cases. Usually it is unilateral. Failure of descent associated with 3 to 4-fold of increased risk of testicular cancer. The consequences or the complication of cryptorchidism, including infertility, failure of spermatogenesis, or and in the future testicular cancer. لهذا يرفعوها إذا ماكو descent، إذا ماكو descent or they correct it surgically, because there is an increased risk of cancer with this congenital anomaly, especially seminoma. Tubular atrophy and sterility or infertility is a complication also. Foci of germ cell neoplasia in situ can be precursor for testicular cancer in cryptorchid or cryptorchid testis. شبابنا شنو تشوفون؟ هذا المفروض هذا نورمال. اكو بالوسط اكو sperms maturation, still there's maturation here. هذا شو نسميه؟ إذا تتذكرون بالصف أول histology, testicular histology. This is called testicular atrophy. شباب testicular atrophy. Testicular atrophy. No sperms, no germ cells within the seminiferous tubules with thickened basement membrane of the seminiferous tubules. The seminiferous tubules are occupied only by supportive Sertoli cells. No spermatogenesis, no germ cells within them. هذا اللي احنا نسميه testicular atrophy. Testicular atrophy معناها no spermatogenesis, no germ cells, and the seminiferous tubule is occupied only by Sertoli cells. The causes or the risk factors for testicular atrophy. Testicular atrophy, atherosclerosis in elderly people is the most common cause, narrowing of the blood supply to the testis, mostly in elderly people. The end stage of inflammatory process, orchitis, whether acute or chronic, viral, bacterial, or non-specific, whatever the etiologic factor. Orchitis means inflammation of the testis, or called Epididymis, called Epididymo-Orchitis. The end stage of an inflammatory process, atrophy, like abscessing orchitis or abscessing Epididymo-Orchitis. Cryptorchidism or undescended testis. They are sterile معناها infertile, no spermatogenesis, failure of the spermatogenesis. Why there? شباب السؤال. Why there is infertility? Why the patient with cryptorchid testis presented with infertility or sterility? Why? ليش يصير عندهم fertility؟
نعم دكتورة.
تفضلي. اي نعم.
دكتورة، لأن هي ما راح تنزل التستس، ما راح يصير بيها ديسنس، فراح تظل بالابدومينال كافيتي، ودرجة الحرارة هناك غير مناسبة لتصنيع السبيرمز، فراح يصير عندهم infertility.
More than 37 degrees centigrade is unsuitable for spermatogenesis. Okay, generalized hypopituitarism, also including FSH and LH, can affect the maturation and can affect the central stimulation of the and testosterone production. Generalized malnutrition or cachexia. These people can also have testicular atrophy. Radiation to the pelvis is also one of the risk factors for testicular atrophy. And prolonged administration of female sex hormone for treatment of prostatic cancer and cirrhosis also can counteract the testicular function and result in testicular atrophy. من نقول testicular atrophy معناها seminiferous tubules are atrophied, hyalinized without effective spermatogenesis and with thickened basement membrane. شوفوا شباب، هذه seminiferous tubules اللي هي المفروض full with germ cells، اللي هي المفروض تصير كبار وبالنص يصير السبرمز. They are totally obliterated or totally hyalinized, no spermatogenesis, and this is only extra interstitial Leydig cell hyperplasia, interstitial Leydig cells, no germ cells, some germ cell aplasia or or testicular atrophy or germ cell aplasias. Inflammatory lesion of the testis and epididymis. ايش تتوقعون شباب؟ What is the most common cause of inflammatory process, acute and chronic, in the affecting the testis and epididymis? منين يجي السورس؟ What is the most common cause or source of infection in the male genital tract, especially the testis and orchitis or Epididymo-Orchitis? Most commonly spread from urinary tract infection, prostatitis, cystitis, urethritis can spread the infection to the testis and epididymis. It can be non-specific epididymitis and orchitis, or can be infectious or can be non-infectious. شلون يعني infectious non-infectious? Infectious bacteria or viruses, and non-infectious like trauma or autoimmune process. Usually the spread of the infection from the lower urinary tract. Mumps is a virus can affecting the testis with edema, congestion, lymphocyte and plasma cells with tubular atrophy and loss and sterility in the future. Mumps orchitis. Epididymo-Orchitis, inflammation or infectious process of the testis and epididymis with abscess formation. Here, collection of neutrophilic exudate within the seminiferous tubules, and if it is affecting the epididymis, also called Epididymo-Orchitis. TB is a special type of granulomatous inflammation affecting the epididymis and can also result in sterility and obstruction of the tubules with caseous necrosis and granulomatous inflammation. Testis and epididymis, non-specific epididymitis and orchitis. In sexually active male, chlamydia and Neisseria gonorrhea are the most common, whereas in elderly people older than 35, urinary tract pathology like E. coli and Pseudomonas are more common. Specific inflammation, non-specific معناها الإيكولاي والجونوريا والكلاميديا, whereas the specific mumps, tuberculosis, and syphilis is vascular disturbances affecting the testis. One of the important vascular disorders affecting the testis is testicular torsion. Torsion or rotation of the testis around the pedicle and that affect the rotation of the testicle around the spermatic cord, result in venous obstruction and vascular engorgement. The result in this severe surgical emergency in male. The patient is usually in teenager age group, and they are resulting from poor attachment or ineffective attachment of the testis to the surrounding soft tissue, and this will result in rotation. It is one of the vascular abnormality, rotation of the testis around the spermatic cord, and result in venous congestion and engorgement, and should be surgically corrected. أول شيء يعني at the start they try manual untwisting, manual treatment. If it is manual untwisting within 6 hours, if it is failed, surgical removal or surgical hemorrhagic necrosis can be developed as a complication. There is anatomical defect or that allow mobility of the testis within its location. Okay, testicular torsion or testicular twisting. It is a urological emergency, should be corrected manually corrected within 6 hours. Many will have manual correction. It is liable for recurrence also, and surgical correction after failure and hemorrhagic necrosis can result. Painful, urgent urological emergency. Testicular tumors. Tumors of the testis occur. ايش تعتقدوا من most common testicular tumors or prostatic tumors شباب؟ شنو تعتقدون most common testicular tumor or prostatic tumor? Prostatic tumor is far more common than testicular tumors. Testicular tumors occur in 6 and for each 100,000 male. Most of these malignancy occur in young adults, 15 to 35 years old, and post-pubertal male. 95% of testicular tumor arising from germ cells are malignant. Axial ovarian tumors, شباب. Axial ovarian tumors. Germ cell tumor of the ovaries, most of them are benign, whereas testicular tumor, testicular germ cell tumor, most of them are malignant. 10% of population of these patients have history of cryptorchidism, history of another congenital anomaly. Family history is also important. Gonadal dysgenesis and intersex, ambiguous genitalia. These are liable for carcinoma or testicular tumors, malignant testicular tumors. The presentation is painless, hard. First presentation is painless or sometimes painful, hard fixed scrotal mass. Pain increase when there is increase in size and bleeding inside the tumor. The tumors of the testis شباب مثل lung cancer, مثل lung tumors يقسموه small cell lung cancer non small cell lung cancer. هنا همين يقسموه إلى seminomatous and non-seminomatous germ cell tumor. Seminomatous and non-seminomatous. Seminomatous because seminoma is the most common tumors in the testis. It is the most common type. Seminoma is من نقول seminoma ايش تعتقدون هذه benign لو malignant شباب؟ الاسم مالتها الشيوحي.
benign tumors.
benign.
اي هو بنفس التيومر تعرفون هو كلها germ cells نفسها هي germ cells إذا بالأوفري وإذا بالتستس even in the chest in the brain germ cells تطلع وين ما كان ممكن. سيمينوما نفس الفيتشرز نفس سيمينوما and dysgerminoma نسموها الidentical identical to ovarian dysgerminoma واثنيناتهم malignant. Most common type of germ cell tumor up to 50% of germ cell tumor of the testis. Never occur in infant, peak age 40 to 50 years, solid homogeneous gray white, microscopically هذه الفيتشرز هسه نشوفها 10% have elevated beta HCG. شوفوا شباب هذا البيكتشر شوفوها mass, solid firm mass within or hard mass within the scrotum, painless بعدين يصير painful. Mass within the testis or tumor here. This is the normal parenchyma of the testis and this is a mass, hard mass fixed in the scrotum by ultrasound or MRI. Beta HCG and alpha fetoprotein. The hormones can be or markers in the serum can be secreted by testicular tumors, seminoma, or غيرها. The tumor is made up of sheets of polygonal cells with clear cytoplasm, rounded nuclei, prominent nucleoli. يسموها fried egg. شباب fried egg cells. Well-defined cell border, well-defined cell border, well-defined cell margin, perinuclear vacuole, and rounded open chromatin nucleus. Fried egg histology or cells. These sheets of cells, of malignant cells, are crossed or separated by intervening stroma filled with lymphocyte or rich in lymphocyte. نفس البيكتشر هذه نفس الفيتشر microscopically هي نفسها identical to ovarian dysgerminoma. Ovarian dysgerminoma اثنيناتهم germ cell tumor اثنيناتهم malignant and نجي عليها الأوفري أيضا نذكرها identical نقول عليها identical to testicular seminoma هذه نقول عليها identical to ovarian dysgerminoma. Again, this is the seminoma, solid, hard, fixed mass within the scrotum, and this is the higher power, low power appearance. شوفوا الستروما rich in lymphocyte cells هذه typical cell diagnostic cells هنا كلش واضحة. شنو سميناها شباب؟ diagnostic cells of seminoma.
fried egg cell
cells. باعوا هذا membrane أو السيرال border كأنما واحد راسمه بقلم. Cell border is distinct cell border, perinuclear vacuole, and the nucleus is large, rounded, and open chromatin. إيش تشبه هذه؟ علما تشبه شنو هذه السيلز؟ هي أصلاً هي germ cells مو صحيح؟ هي شنو تشبه هذه؟ تشبه الgerm cells within the seminiferous tubules. نفسها الجيرم سيلز اللي تكون السبرماتيد والماتشور سبرماتوزوا نفسها هذه الاماتشور سبرماتوغونيا هذه تشبهها هي كلها جيرم سيلز. هذا هو المالجنت تيومر مالتها. Testicular seminoma can identify solid tan colored mass within the scrotum. ما باقي ولا شوية من التستس، شوية بس هذا rim of testicular tumor. All the testis or testicular tissue is occupied by seminoma, solid tan colored fleshy tumor mass within the scrotum. التيومر الآخر طبعا كلهم malignant، السيمينوما والإمبريونال كارسينوما واليوك ساك تيومر كلها malignant highly malignant. الإمبريونال كارسينوما يسموها كارسينوما لأن يعني هي تشبه بها glandular formation. Also here there is solid mass within the testis with areas of bleeding and necrosis and high ATPL. cells تكون very bizarre، شكلها كلش مخيف. مرات يسموها adenocarcinoma. هي it is not glandular or not all of them originating from germ cells. كوريوكارسينوما، شباب هذا الكوريوكارسينوما عادة هو الكوريوكارسينوما is more common in هذا التيومر of شنو؟ كوريوكارسينوما. تسمعون كوريو يعني شنو؟ يعني شنو كوريو؟ يعني بلاسنتا صحيح؟ تروفوبلاست، سايتوتروفوبلاست، تروفوبلاستيك تيشو أيضا secreting beta HCG دائما هو tumor marker in the serum and in the tissue also. Areas of necrosis are bleeding and bleeding are very common. Cells تكون bizarre cells, large, atypical, pleomorphic. The yolk sac tumor هذا شوية الage مالته younger age group يصير يعني affecting children. Also called endodermal sinus tumor. Endodermal sinus tumor, malignant tumor of the testis of germ cells. اللي هي نسميها non-seminomatous germ cell tumor. Okay. هذا الكاركترستيك microscopical picture يصير like rosette يسموه Schiller duval body and endodermal sinus tumor, also presented as a mass in young age group boy. Yolk sac tumor. Yolk sac tumor is a malignant non-seminomatous tumor of the testis. Okay. فهسه سيمينوما قسمناها إلى سيمينوماتس ونون سيمينوماتس. السيمينوما هي السيمينوماتس والنون سيمينوماتس اللي هي الامبريونال كارسينوما واليوك ساك تيومر or endodermal sinus tumor and choriocarcinoma. هذه التيراتوما عادة التيراتوما in male testicular teratoma are mostly malignant, whereas ovarian teratoma usually benign. من نقول عليها immature teratoma معناها malignant، من نقول mature يعني benign. التيراتوما هي cellular and organelle component of different cell يعني derivatives. More than one germ cell layer، يعني نشوف more than one cell component أو tissue, glandular tissue, neural tissue, bone, cartilage، يعني epidermis, skin tissue and adnexia، وكلها تصير malignant. بنقول عادة بالنيورال tissue تكون malignant component can be formed from at any age from infancy to adult life. It can be combined with other tumor. Combined يعني تجي تيراتوما وياها كوريوكارسينوما أو تيراتوما معها سيمينوما وهكذا. Can be combined with other tumors. Mature it is benign and immaturity is more common in testicular teratoma and نشوف بها immature component or malignant transformation of one component. Okay. فهسه السيمينوماتس non seminomatous اللي هي السيمينوما اللي هي السيمينوماتس والنون سيمينوماتس اللي هي embryonal carcinoma واليوك sac tumor واليوك sac tumor والchoriocarcinoma and also teratoma. Sex cord stromal tumors affecting or originating from the sex cord stroma. From the stroma. يعني Leydig cell tumor or Sertoli cell tumor, supportive cells are the origin of this sex cord tumor of the stroma or the sex cord in between or intervening the intervening stroma. Leydig cell عرفوا أسماء على الأقل. Leydig cell tumor and Sertoli cell tumors. هذه التيراتوما, الcomponent of teratoma can be composed of epithelium, hair, skin, adnexia, neural tissue, retinal tissue, muscle, islets of cartilage and bone, thyroid tissue, bronchial and respiratory epithelium, and interstitial and neural substance and brain. Tumor markers are important diagnostic tools in testicular tumors, including beta-HCG, alpha-fetoprotein, and placental alkaline. 80% of non-seminomatous germ cell tumors show elevated level of these tumor markers. The importance of these tumor markers, they are important for diagnosis, they are important for follow-up, and they are important for monitoring of response to therapy. يعني إذا شافوها عالية بالسيرم of the patient after treatment معناها شنو أكو؟ معناها there is another focus like distant metastasis that is still secreting these tumor markers, and also for evaluation of the testicular mass إذا هي benign أو إذا هي malignant according to the secretion of these tumor markers, biologic tumor markers in the serum and as a tissue markers. شباب وقتكم خلص مو هسه عندكم شيء لو نكمل لو شنو؟
دكتور عندنا محاضرة الساعة 11.
يعني نكمل الأربعاء بإذن الله، آخذكم الأربعاء نكمل الميل ونبدي